Welcome to this talk. Now, today we're going to hear from Dr. Ros Jones in the People's Vaccine Inquiry. Now, we've had the privilege of interviewing Dr. Jones on this channel, and I've met her face to face. She's a paediatrician, in my estimation, of the highest caliber. She takes full cognizance of ongoing research. She's a researcher herself, and she's exactly the sort of person that you'd want to appear in Module 4 of the official UK inquiry. She submitted high quality referenced material, but for some reason or other she wasn't allowed to appear. And this conference in London, this actual People's Vaccine Inquiry, has simply not been reported at all, as far as I can see, on mainstream legacy media. I haven't seen any reports of it at all, despite looking out for it. So I think it's really important that people of this caliber are given the right to speak and the right to be heard. So I think she speaks for about 8 minutes. Do give her the time. Well worth it. Really provides excellent contextualization of the shenanigans, ongoing strangeness that marks the last 4 or 5 years. Over to Dr. Jones now. Thank you.
For those of you who don't know me, I'm Ros Jones. I'm a retired paediatrician. And my first worry was when I saw on early evening television in February 21 an advert for children to join the AstraZeneca trial. And I emailed straight away to the lead investigator, Professor Pollard, in Oxford, who also happened to be chairman of the Joint Committee of Vaccination and Immunisation, though he had recused himself from that role. And just saying, I'm really surprised, Andrew, that you're doing a trial for children without waiting for any medium to long-term adult safety data, particularly given that children are clearly not affected by COVID to any significant degree at all. And to my amazement, I got a reply within 10 minutes saying, "Oh, hi, Ros, you're quite right. We don't know about safety in children, and that's why we're doing this pilot study." Moreover, the other manufacturers are also doing children's studies. So because it was all right for Pfizer and Moderna, therefore it was all right for AstraZeneca. So by May, when Pfizer had actually applied for a proper approval for the 12 to 15s, I'd got together a group, some of you are here, but we've now got over 200 senior experienced health professionals and academics, and we were writing repeatedly to the regulators, the politicians, you name it, we've written to them. But I think we were surprised to be asked to provide a witness statement for the Module 4. We duly presented that, as did my colleagues here. Even I was asked if I would share it with one of their experts. Of course, she was the expert on vaccine hesitancy. And I perhaps naively thought that if she read even half of what I'd written, maybe she'd realise that parents who'd chosen not to get their children this vaccine were acting with wisdom rather than hesitancy. But anyway, we went ahead and we did our statements, and then when we heard that we couldn't, they were again they were saying, "Oh, but thank you very much, your information's been really useful and in our deliberations." But it was blatantly obvious from the word go that nothing we'd provided them with was going to be used at all in any questioning. And we were ascribed to the misinformation box, I think. And it's interesting to remember that actually that very first fully referenced letter we sent in May 2021, before they'd even approved this, was passed by a member of the Chris Whitty's team to the Counter Disinformation Unit, a unit previously associated, I think, with monitoring for online child pornography or terrorism, not for medically, peer-reviewed articles, etc. So if I follow on from what Liz was saying, I think the ethics is the first thing. It wasn't just school closures, was it? It was the masks, the testing, the don't kill your granny. It was very obvious to parents that this was having devastating effects not only on children's education, but also on their physical and mental health. And when the vaccine was provided as the only route back to normal, well, parents also were susceptible to that messaging. So then we come to the risk-benefit balance. Well, as you know, I mean, children, whatever bug was doing the rounds in 2020, it clearly wasn't affecting children. And the death rate in under 18s from with COVID either as the main cause of death or a supplementary cause of death. For healthy children, there was 1 in 2 million. The idea of this for a novel technology, that was another conspiracy word, wasn't it? You weren't allowed to use novel technology. Anyway, so at the end of it all, it was kind of started off saying that this was going to be a differential sort of programme. So Matt Hancock said in Parliament that this was a vaccine for adults. Kate Bingham went further, said it's for the over 50s or those with health vulnerabilities. But in the inquiry, nobody pushed on why this vaccine juggernaut was totally unstoppable. Professor Lim from the JCVI actually said in his statement that if they'd stuck with that phase 1 rollout, that would have accounted for 99% of the deaths in the first year. But they couldn't, it was like they couldn't stop themselves. So that brings me to the approval process. Well, in June 21, the MHRA authorised this. They only used Pfizer data. That had 1,131 children given the vaccine and followed for 2 months. Now, you don't have to be a medic to know that can't constitute a safety study. But that's all they would look at. They then passed it to the JCVI, who, in fairness, deliberated for quite a long time. There was also a moral and ethical advisory group that had been set up in 2019 for some reason. And they specifically said in their minutes of their March meeting that they wanted to be involved in decisions about COVID vaccines for children. They had a meeting set up for June, and the meeting was cancelled because they were told that the plan was it wasn't going to be given for children. So they were cancelled, and in July, the JCVI said, no, this is not suitable for healthy under 18s. Within 48 hours, they were asked by the Chief Medical Officer to call an emergency meeting to reconsider their decision. Now, why did nobody pin Chris Whitty down about that? Why did also nobody pin him down about the fact that when it got passed to the Chief Medical Officers, they decided to say yes for 12 to 15s. It has to be on health grounds to the child. It can't be about other people. It has to be to the child. That's the law. And they said, oh, it would improve their mental health because it would keep schools open. And he did a calculation, which actually, if you looked at the amount of time for schools to be open, it worked out an average of 15 minutes per child. Well, that's less than the time it would take to go out of class and get your vaccine and wait for your statutory 15 minutes before you went back to class. And he acknowledged it took no account of vaccine injuries, which we know about 8% of children were saying they needed to have a day off school because of post-vaccine short-term side effects. So I will talk a bit about myocarditis, because that is the... Oh, there we go again. Myocarditis is one of the few side effects that has been acknowledged, and it's now on the public patient information leaflet. But they keep saying, and I mean, Hugo Keith several times described it as very rare. It's very rare, and it recovers quickly. Now, how rare is rare? It depends, as Jonathan mentioned earlier, on how hard you look for things. So Israel was the first country where there was a cluster of cases, and they immediately wrote to all their paediatricians, cardiologists, emergency care physicians, telling them to look out for this and report it if they saw it. So they came up with 1 in 6,000 for adolescent males in 15 to 19s, and that was 10 times higher than for over 30s, was the under 20s. Again, that's not, for Mr. Keith's information, that's not very rare. That counts as rare if it's more than 1 in 10,000. That's rare. Hong Kong, they actually gave a leaflet to the parents at the time and said, look, these are the symptoms to look out for. They have 1 in 3,000. But Thailand did what, of course, we should have been doing here, what the MHRA should have demanded of Pfizer, which is to do a proper prospective study, 2 big secondary schools, all the children having their second vaccine were given a diary card to keep, and they were also given a blood test and an ECG before and a week after their vaccination. And they came up with a really worrying 1 in 29 children, boys, had an evidence of either subclinical or clinical myocarditis or pericarditis. Now, that's not rare, it's not uncommon, that's common in the definition of being more than 1 in 100. But again, nobody raised that at the inquiry. Now, what about mild? Well, the US teenagers who were admitted to hospital with chest pain, they did seem to get better very quickly. Within a day or two, they seemed to be fine. because it was a new condition, the team there thought they'd better do MRI scans on them, and they found, rather horrifyingly, that almost 90% of them had abnormalities on their cardiac MRIs. And this was the group that the JCVI had mentioned in their meetings. They had an online meeting with this American team and with an Israeli team. I had online meetings with the same two teams, so I had the same information, which they kindly shared. Oh, yes, it gives them the same information they gave to that other English group, which turned out to be the JCVI. But they weren't allowed to wait 6 months, were they? And in the States, they have now very recently, it's taken them 3 years to publish their 6-month follow-up data, but it shows 60% of those kids have got consistently present scarring. And this is the sort of changes that you see with a reduction in 5-year life expectancy following myocarditis due to other preceding viral infections, etc. So this is not a benign drug. And in fact, there was a leaflet round saying that if you had myocarditis, as long as you'd got better completely, then you must wait 12 weeks instead of the normal 8 weeks before you had your second dose. Very weird. So something Sajid Javid said, actually, before I come to that, Sajid Javid said that it was Boris kept badgering him all the time. You know, how could we let Spain or Israel get ahead? You know, we've been ahead for getting the first adult dose, and now we were really behind the curve getting it out to children. So Sajid, in his cross-examination, he said, you know, I was very experienced, I'd been Chancellor, I knew how to stand up to the Prime Minister, and so I just kept saying, Prime Minister, you know, there's a process, it has to be followed, we have to do it properly. But what he didn't, and nobody said to the Prime Minister, is, actually, Boris, this is about a serious safety concern. And I'm sure you don't want children to die for you to win some race. But nobody said that, as far as I can see. And another thing Sajid mentioned was that he was worried about inducements. Somebody suggested they should have financial inducements to get teenagers and so on, young adults who didn't feel worried about COVID, to take this vaccine. And he thought that wasn't a good idea. But he doesn't seem to have noticed that Charlton Athletic Football, they were offering free football tickets to the first 1,000 people who went to a pop-up clinic at their football ground. There was pop-up clinics at Thorpe Park Theme Park and the Ministry of Sound nightclub. There were free Uber rides, pizzas. I mean, in my career as a paediatrician, I've never seen a vaccination programme launched like this, never. And then there was another thing, which, of course, he also mentioned, Sajid Javid, I'll quote, he said about inducements, if you get a vaccine, it should be for a positive reason, to protect your health or protect your loved ones from infection, rather than some kind of inducement. So he's obviously forgotten there, again, that for children, it is illegal to give them something for somebody else's benefit. It has to be for their benefit. So how did the NHS approve adverts like this? You know, you imagine the mother is in the middle of this picture. They've left her out of this 3-generation family photo. She's thinking about her mum, who's quite vulnerable, and then she's thinking about, do I give this potentially toxic drug to my little girl? And you know, I just despair. And I think I'll hand over to Claire, because I'm sure she will tell us that actually vaccinating adults, or children to protect adults, just wouldn't work anyway, even if it were remotely ethical.
Well, there we have it. Such obvious questions to ask. Chris Whitty might want to reply to some of those questions to clarify the situation. I've made a long list of notes here, but I'm not going to go through it. Ros put it so well and so clearly. So we'll leave it there. I just feel it's important to get this out. And it's also important not to get cross. I have to try hard not to get cross. Keep this cognitive and objective, as Dr. Jones did there. So thank you so much for watching, and thank you so much, Dr. Jones. And I think the next clip we're going to hear in the next video is from Dr. Claire Craig, the pathologist. I mean, what's the point of having brilliant pathologists and brilliant paediatricians if we're not going to listen to them? Anyway, for now, thank you for watching.